I'm going to be speaking today about American health collapse, longevity starts in childhood. What is the American dream? To fully experience life, liberty, and happiness, to build a better life. What is progress? To give your child a better life than you had, or at least as good of a life. The opposite is happening. We're experiencing American health collapse. What is American health collapse? American health collapse is that millennials, I'm a millennial, an elder millennial, thank you. Millennials are on track to have shorter lifespans than their parents and shorter health spans. This phenomenon actually started 6 years prior to COVID. We started to see a decline in life expectancy. What was the #1 driver in the decline in life expectancy six years prior to COVID? Processed food-related disease. Processed food-related disease are taking years and healthy years off of our children's lives. Actually, processed food-related disease is the top driver of COVID, hospitalization, severity, and death. Processed food-related disease not only are taking away our lifespans and our health spans from our children, they're actually making us less resilient to pandemics. If we want a pandemic-proof society, we need to invest in real food access for our children and for our families. American health collapse is happening, yet the opposite is possible. Unprecedented longevity is possible. We heard so many of the speakers talking about longevity and what we can unlock. The oldest person living to 122 and most recently even longer. There is incredible, as we all know, medical and technological advances to help people achieve longevity, yet that is for a very select few. The mass majority of Americans don't feel well. 93% of Americans are cardiometabolically sick. We have a massive health crisis on our hands. As a mom, what's most striking to me about our health crisis is actually the children's health crisis and children's health collapse that I'm witnessing. This is actually 2017 data that showed by 2060 there will be over 600% increase in type 2 diabetes. Type 2 diabetes is a preventable processed food-related disease. This is old data. We need better national data. In that there was a 77% increase in type 2 diabetes during the pandemic. So it's much worse than this. Many cancer subtypes are increased in adolescents and young adults. And we know what feeds cancer cells: added and free sugar. There was a 59% of 2-year-olds will be obese by 35. My son is a 2-year-old, and this is very concerning for me about the health environment and the food environment that he's growing up in. 1 in 5 youth are now pre-diabetic. So one marker of our food system is how much sugar is in our food system as a key ingredient in ultra-processed food. Do you know how much sugar we consumed in the 1800s? I'm going to show you. It was about, let's get this out. It's about 4 pounds of sugar we ate, which then it was even pretty new. Now, do you know how much sugar our kids eat a year? 65 pounds of added sugar, and we actually think it's more than that. That is enough sugar to fill a bathtub a year. Our kids are eating a bathtub of added sugar a year. This is not making them healthier. This is just one of the things that our program looks at as we transform our food system in America, but our program actually removes 15 pounds of added and free sugar from children's diets. So in this moment, we just saw that the American Academy of Pediatrics introduced weight loss drugs for 12-year-olds and surgery for 13-year-olds. That's not a long time to be on this planet. We can increase access to kids' food early in life and to their families to prevent these diseases before they start, to stop disease before they start. So things like surgery and drugs aren't needed for a child so that they can be on the playground instead of in the doctor's office or on the surgery table. This is a massive challenge. I will say that also the Surgeon General just called for massive action on our mental health crisis, and food can be a key ingredient in creating mental health and happiness for our youth. Actually, I have a daughter as well, and it's really concerning to me, particularly our girls' mental health crisis. We know that that 57% of teen girls who persistently felt sad or hopeless. This increased dramatically in the last decade, in 10 years. Our girls don't feel happy, and we know that serotonin, 90% of our serotonin, the happiness hormone, is made in our guts. Food can feed mental health. This has a huge impact on our economy. In the United States alone, $4.1 trillion is spent last year on healthcare. We call that sick care because 75% of those costs, about $3 trillion, is actually ultra-processed food disease. This is preventable, and we don't need to print as much money. We spend more as a country. This is the United States spending the most per person, and our life expectancy is the lowest among high-income nations. This is unacceptable. We're the richest country in the world, yet we have the worst health outcomes. I actually really appreciate this global health dashboard showing red alert. We have a massive problem on our hands, and we must do more. We were advisors on the White House Hunger, Nutrition, and Health Conference, and they set bold, important goals to reduce processed food-related disease and end hunger by 2030. This is a very important step forward, but as I just mentioned, we are not on track whatsoever. I think that we need a national dashboard that shows our progress against those stated goals. So I just quickly did this on Canva last night, showing that, how do we have month-over-month live tracking around how are we doing on ultra-processed food disease, how are we doing on hunger, how are we doing on unhappiness. Ideally, in a dashboard, you would look at sleep, exercise, social connectivity, et cetera, as well. But we should have a national health dashboard showing how our population is doing, and we could go global with that. I will add that this is quickly becoming a global problem. In the United States, we export our food system and we export our problems, and we're seeing that, and we just heard that this is a global problem, and we need global coordination as well as national coordination across government agencies. So 67% of our kids' calories are ultra-processed calories. Our food system can help reverse this problem. Our food system can help solve American health collapse. There's a Desmond Tutu quote that says, "Don't go where the bodies are being pulled out of the river. Go where the bodies are being put in the river." We can increase real food access early for children and prevent these diseases, these costs, this state of health. So what do we do about this? We find leverage points in the food system and transform our food system. This American health collapse is a recent phenomenon. We can reverse it. The people in this room can help reverse it. So what we did was we decided to look at the biggest leverage point in our food system as my nonprofit. And my nonprofit does advocacy at a national and state level. We do awareness building, and then we transform food access. So we decided to focus on the largest fast food restaurant chain in America. Do you know what that is? Subway, okay. Actually, yes, thank you very much. Subway, there are 20,000 unit locations of Subways in America. But actually, that's not the largest fast food restaurant chain. The largest fast food restaurant chain in America is our public schools. There are 90,000 public schools. They serve 7 billion meals to 30 million students. Imagine if this was the best restaurant in town, serving delicious, culturally relevant, sustainable, beautiful food that inspired the students and supported their learning, growth, and health. So that's what my nonprofit does. We're an organization dedicated to increasing school kids' access to the nutritious, sustainable food that they need to flourish. We believe that real change starts in the cafeteria. This is G1 on my team, eating an amazing salad bar. This is an organic Cobb salad with avocado in North County, Monterey. This is Loco Moco being taste tested with whole grain rice and delicious sauce in Natomas Unified, which is the third most diverse district in the country. And I just asked some of our food service directors. We empower change makers to do community-driven change, transform their food system locally. So I asked those change makers, these nutrition directors, send me your photos from school food this week. This is what's on the menu. I want this delivered on Uber Eats right now. I wish they were catering our lunch because look at how good this is. It can be delicious. This can feed health. So what our program does is we have a holistic approach to transforming the food system. We add in the good and we take out the bad, and do things like add in real food, cut 15 pounds of sugar per student per year, add in more local, and add in plant-powered choices. What can you do? So I created this quick framework for you. So in your family, you can eat real food. You can raise real food awareness, share about American health collapse, talk about it in your family. You can tackle this in your job. You can definitely tackle it in your industry. Hello, health tech. And you can get your schools and your local community involved. We have a wait list of over 2,000 schools, but we're happy to start partnering with more schools and unlock that wait list. You can back scalable nonprofits like Eat Real. We're on track to shift $1 billion of school food purchasing by 2025 with just $20 million of support. We can make massive change quickly and change this health trajectory for our kids. We also need your voice. There are some major national policies being voted on right now. You can go to eatreal.org and learn on our blog about raising your voice for national nutrition standards, as well as reimagining the Farm Bill. So instead of subsidizing corn, wheat, soy, sugar, we subsidize things like vegetables and fruit and regenerative organic agriculture. And so we need your help and your help getting involved in this. Finally, I'll just say that real food helps stop disease before it starts. Real food is our best chance at giving longevity for all. Real food is the best way to reverse American health collapse and give every child health, happiness, and liberty. Thank you.
Thank you.
And I hope you'll join us. Thanks.
Thank you very much, Nora. Just amazing, really, when you think that it's the school system that actually is the largest bad restaurant chain in America. Amazing when you think about that and just the implications of that. So in essence, really, the lunchroom at school should be the classroom at school. That really is what you've been kind of summarizing here, and about the importance of healthy food.
Yeah.